Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Welcome back to part 2 of our fascia conversation. In part 1, we explored what fascia is, and today I want to explore what fascia looks like in real people, in real patients, because this is where you might be able to take some of this home and start applying in your day-to-day life immediately. This is where anatomy becomes actual patient experience and application, and it's where fascia becomes one of the most fascinating lenses through which we can understand stress, pain, trauma, adaptation, and inevitably healing. So if you're a perimenopausal woman, you come to me saying, I don't know if it's my hormones, my doctor said my labs are fine. It's not just that I'm looking at your gut health, your hormones, your trauma, your movement on a daily basis, or inflammatory markers in your labs, or nervous system regulation as separate conversations. They're different expressions of one organism, of your organism adapting to its environment. And fascia is in the middle of all of those conversations. So I started asking even sooner in my relationship with patients, where are you bracing? I'll often say in a first visit, where do you hold your stress or tension? Very often I can even see a patient grabbing their neck and massaging throughout the visit. And I immediately know, okay, that's a place where we have stagnation in the fascia. I'm asking, where are we not moving throughout our day? Are we sitting constantly? Are we never getting up and taking breaks if our job requires us to sit? Where has fluid become stagnant? Are we hydrating that fascia? Where are we organizing around protection instead of flexibility? And more importantly, how is dysregulation in this system or tension in this system manifesting uniquely in this person? So sure, I might tell all patients how important releasing our psoas is for feeling safe. But for one patient, the psoas is going to be more important. And for another patient, the occiput or the muscles underneath your occiput and the tension you hold in your neck is going to be more important. Now, I might then get my hands on that patient and find a craniosacral rock that works really well for them and teach them how to do that at home. But all of this comes down to how is fascial dysregulation looking in that person uniquely. I have many female patients who have hypermobility. I am one of them. I'm not my own patient, but I'm very hypermobile. And I used to get migraines, and hypermobility and migraines, you might think, oh, mast cell, histamine, right? And maybe that patient also has pelvic floor dysfunction. Well, sure, mast cells are going to be important, but immediately I'm thinking about the state of their fascia. And if they're getting sensory overwhelm, does it have to do with the health of this connective tissue system? In some patients, it's not hypermobility, it's rigidity. It's shallow breathing, that chronic neck tension, or your shoulders being up in your ears. Chronic constipation is a big one that fascia plays a role in. Poor lymphatic flow. You can see now how this is all connected, right? I might say that some of the clues that you have a dysregulated fascial system, or maybe a restricted one, would be things like autonomic dysregulation, those POTS type symptoms, dizziness, temperature dysregulation, mast cell activation, digestive hypersensitivity, panic physiology. So you can see how a lot of the things I work on with women can really be looked at through the lens of fascia. And you might see structurally adhesions and tension and trigger points and jaw clenching and repetitive strain patterns, or places where that person holds tension. You might also see that some patients present really more structurally. So it's very clearly a focused pain area or a trigger point. And it might be both. There might be an emotional component, there might be a nervous system component, and there might have been a trauma or an injury to an area. And if you think about the conversation around trigger points, again, this is all about fascia. Because what we often call a muscle knot or a place of tension that you can probably find on your back or on your shoulder is not just tissue twisted into a ball. It's not just a knot, right? It's not just a mechanical knot anyway. There's so much more to it than that. I remember a patient back when I was in clinic in about 2011 or 12, and she was diagnosed with fibromyalgia. And now looking back, her case makes so much more sense to me on so many levels. I've thought about her a lot throughout the years. And neurochemically, there's active inflammation in that environment. It's being maintained or fed by nervous system signaling. And if the nervous system is in that sustained contraction because of a trauma, because of a stressor that overwhelmed the system, then this is an entirely different way to think about pain than just, oh, there's a point there that I want to release. And it's not ever as simple as that. She was covered in lidocaine patches and she was weaning off medication. And yes, there needed to be some mechanical, physical tissue unwinding, but that was never going to be sustainable. That was never going to hold. So, yes, research has shown elevated inflammatory mediators inside active trigger points, including substance P and bradykinin and all other inflammatory cytokines. So, yes, that physically was a knot, but it's also communicating with her autonomic nervous system. And her autonomic nervous system created some of that physical experience of that knot. She had an extremely traumatic childhood. She currently still had extremely high stress and did not live in a safe environment. And so just releasing that physical knot was never going to be the resolution of her pain symptoms or her fibromyalgia. There was so much more to it than that. But when we're in a prolonged threat state, we are chronically contracting. We are restricting our diaphragm and our deep breathing that activates our rest and digest and heal parasympathetic nervous system. In particular, she always had her shoulders elevated up by her ears. She was chronically activating her trapezius and her pelvic floor was tight. And she was even sitting a lot for work. So that psoas muscle was contracted and restricted. And we've talked about this before, how the psoas muscle connects your upper and lower limbs and it is active in that fight or flight response. So she was never getting inputs of safety. She was never feeling safe enough mentally, emotionally, or physically to heal. And so, again, with a patient like that, I might find that just releasing her suboccipital muscles in clinic and allowing her that space to breathe was step one, but then teaching her how to do that at home, utilizing nervines to calm her system. Yes, doing some deeper therapeutic work. Absolutely. All of these layers were communicating through the fascia and then also releasing it. Because, of course, if you're bracing and contracting all the time and you're tense and tight, eventually you're going to say things in clinic to me like, I can't relax. I'm wired but tired. My body's responding to everything. They're not emotional metaphors, they're physiologic descriptions. And yes, absolutely, that is then going to trigger anxiety and or depression. And once I was able to make these connections with patients in clinic, I really stopped seeing chronic tension as just a physical issue. I probably never saw it that way because I was trained in mind body medicine in medical school, luckily, but it becomes really clear the more you work with patients and say you work on the physical plane of existence, I call it. So we worked on the gut brain axis, we worked on a healthy terrain and diet and movement, but there's still something left. Well, then, yes, it opened up more conversation for me around the nervous system and around the role that fascia might be playing in those patients. Because the more dysregulated someone's nervous system was, the more armored their organism had to become physically too. And that obviously makes physiological sense. The more that we're perceiving danger constantly and we're tense and we're protective, we're then rigid, not only in our physical stance, but also in our mental outlook. And over time, that protective physiology becomes chronic. So it's one of the reasons I really started paying attention clinically when I would first meet a patient to their breathing patterns, their rib movement, their jaw tension, their gait and posture, their voice. And essentially, it's how I could assess immediately the health of communication pathways and therefore the amount of safety that person felt in their system. And I've started to see that more and more patients are coming in that dysregulated and tight, tense state. And more and more patients, I think, are profoundly armored, not just emotionally, but physiologically. And I really had to kind of get honest with, okay, the plans and protocols I'm giving patients, it sometimes is just adding to this tension and this overwhelm. So how do we get into a safe healing state to then also make the changes that we need to make to do our nature cure work together, right? How do we get our system into a healing state so that the hydration and the food as medicine and the movement really lands in a system ready to heal? I was having dinner the other night with my friend and yoga teacher, and she was saying how a student of hers is just so hypervigilant in their body and they can't even relax in Thai massage with her. And she has to kind of hold and move their limbs and allow them to feel safe first, and then she's able to stretch and do her work. And I was just nodding in agreement, like, yeah, I see this all the time. Patients really need this sense of safety and containment and support. And essentially the organism needs to stop fighting gravity and threat physiology all day long, and providing this safe space is one of the true ways to get that patient to be able to heal even. And so I love the work that she's doing for that reason. I know I can say to a patient, well, I know a place where you can feel safe and you can start to heal. And that's why, again, I've been teaching so many patients about just going home and using yoga blocks or using a fascial release technique to feel that release, to feel that communication pathway open up, to feel that sense of fluidity and space in their cells, which essentially is what you're achieving when you work on an adhesion. So now almost every patient I work with ends up on yoga blocks at some point if we're able to. And it's not because they're a magical fix, nothing is, but it's really changing the messages that their body and mind is receiving. So when we are placing our bodies into supported positions that say open that diaphragm or allow that chest to open and process grief, for example, and allow our rib cage to move differently and our psoas to soften and release because we're laying with our legs stretched out maybe on a block itself, and we're telling our body, I'm safe, I can heal, I can relax. This is where I'll see emotional releases happen. It might just be yawning. It might be a little bit of warmth. It might be digestive bowel sounds moving or a spontaneous deep breath or sigh. And it's such a beautiful thing to watch because I'll see patients who I maybe didn't realize how restricted and tight they were when we were speaking, even though I was assessing all those things I just mentioned. And then when I see them lay and release onto the block, I'm like, oh yeah, like you're really letting things go now. And it's just so wonderful to witness. And this is where the naturopathic concept of obstacles to cure is just so important and foundational to the work that I do, because sometimes the obstacle is not just a pathogen or a nutrient deficiency. Yes, I start with those really detailed, comprehensive labs that have probably never ever been done. But sometimes the obstacle is chronic sympathetic bracing. It's loss of diaphragmatic movement, loss of adaptability in the organism, poor lymphatic flow due to fascial adhesions and restrictions, loss of connection to the body itself. If I'm working with a patient and they cannot do a breathwork practice, they cannot sit and practice mindfulness, very often it's because they're in pain, because their fascia is restricted. And if those patterns remain in place, then they cannot fully reorganize toward healing, no matter how many supplements I give, no matter how many breathwork practices I walk them through. So over the last 13 years as a practicing naturopathic physician, the medicine that I impart on patients is so much less about forcing physiology, even though I'm focused on a healthy terrain, but it really is about restoring conditions for healing to occur, restoring movement and breath and working on those fluid dynamics, restoring safety, restoring relationship between all of those organ systems that were never meant to function in isolation. They are meant to communicate, they are one. And if you go down the rabbit hole of hypermobility, as I hinted at, and I think I probably just need to do an episode on this, but this is why hypermobile patients became so fascinating to me. And because I'm hypermobile myself, it's not that I'm too loose, it's that I'll become guarded. My fascia, my system will guard to protect and prevent injury. So now the nervous system's trying to create stability through muscular tension because the connective tissue itself feels unstable. So that muscular tension then translates into how I'm experiencing my mental or emotional state or my reactivity to the world. And this is really important. And that's why I'm going to have more episodes on it. That's why hypermobile patients or EDS patients might present with migraines and TMJ and pelvic floor dysfunction and POTS and mast cell activation and gut issues and sensory overwhelm all at one time because the organism is compensating globally. Your entire system is trying to make up for that hyper flexibility that feels dangerous and unsafe to the system. I think I shared back in episode 6 that I experienced a lot of vasovagal syncope and fainting when I was a kid. And I don't think anyone tied it to nervous system dysregulation then. But when I look back at my own health history, so much of these pieces connect. And I really love being able to then use those experiences to not only explain it to you guys as listeners, but also when working with patients. Because more force was never the answer for in my healing journey. More listening was, more subtle awareness of my system, of where I held tension, of where I had to be softer, of where I had to have more strength in my system to not compensate, but to balance some of that hypermobility. And so many people, as I said, come into my office just braced and not sure where they need softening and where they need support and how to get into that healing state. And one of the ways that, say you're listening to this and this really resonates, well, one of the ways that you can start doing this work is through touch. So if you do have a bodywork practitioner you feel safe with, touch is going to change your organism response. So pressure and breath, and again, that sense of safety. And this is where the craniosacral therapy work I do with patients comes into play. Myofascial release or visceral manipulation, so manipulation of the fascia around our organs. Again, somatic work or psoas release, suboccipital work, really restorative movement practices are so important. So find someone you feel comfortable with who does a bodywork practice. Maybe it's Thai yoga, massage, and really start to understand the patterns that your fascia gets into. Where do you hold tension? And let's give a simple example. I might know that a patient is going through a grief process. So I might have them lay on a yoga block under their chest and just open up their chest. And I might have them close their eyes and maybe dose a homeopathic remedy for grief and just sit. And I say, lay on that block for 3 minutes at least. Give the body time to unwind and you will start to notice what's going on. It's actually that simple. I would never get bored. I could sit on the floor for hours, whether it's with my eyes closed meditating or eventually I lay down and just feel the articulations of my spine and different movements and stretches. There's so much work that you can do internally when you're able to get quiet with self. So if you want to start with another nervous system to co-regulate with, find someone you feel safe with that can do some hands-on body work. I mean, a healthcare practitioner. And this can start to help you understand the relationship that you have with your fascia. And I do think naturopathic medicine has always understood this. We've always looked at the organism contextually, our terrain, our vitality, our adaptability. We're cultivating that the vis medicatrix naturae is that healing force within. You can go back and listen to our entire episode on that. We're never suppressing, we're listening to the body. And the fascia, as I said, is the communication pathway that we are listening through. And if you want to add in some layers of, say, herbal medicine to this conversation, you can think about connective tissue quality. And so, yes, we talked about hydration, but you can also use demulcent herbs, for example, like marshmallow root, plantain, slippery elm, aloe, or mineral rich nutritive herbs. We talked about nettle in our last episode. And you can start to use these herbs to essentially work with your fascia as well. You can use plant medicine to work with mast cell reactivity, mucosal integrity, or just the extracellular environment surrounding cells. And similarly, when I'm using homeopathy or drainage medicine, or gemotherapy, I'm really interested in the subtle signaling and essentially the communication with that fluid matrix that plant medicine imparts on the patient. And so, yes, you can still have adhesions, you might still be tight or bracing, but as we start to work with all of those energy medicines and different frequencies, they're going to land then in a body that's safe and ready to feel and heal. Because most chronically ill nervous systems don't need more force. And through any transition, perimenopause, menopause, puberty, we are needing coherence. We're needing coherent communication within, and then ability to have coherence within the rest of the system and the other nervous systems around us. And say you're using some of that herbal medicine and maybe doing some block work, you're going to notice that your breath inevitably changes, even if you're not actively doing breath work. And remember, breath is not just oxygen exchange. Breathing really changes pressure systems throughout our organism. It's going to impact lymphatic movement, and lymphatic movement is going to impact our ability to breathe. And vagal tone is going to be playing a big role here. So if you have a ton of neck tension and your vagus nerve is impaired by that neck tension, then now you've got the gut brain axis communication pathway being compromised. And again, that breath not getting deep and you not getting into that rest, digest, and heal state. So breath and the diaphragm are going to impact cerebral spinal fluid movement, and our pelvic diaphragm and our respiratory diaphragm and our thoracic inlet and our tongue and all of these are all connected through fascia. And say you're doing a breath work and you start to feel your body release and soften, sometimes that's the moment you realize how armored and how tight and restricted your body has been. It's why sometimes people will cry during breath work or restorative yoga practice. It's not that just that emotions are trapped in a muscle, but it's that the autonomic protection finally softens enough for movement to happen and for you to experience fully maybe what emotion is now being moved through you that was being held back. And the more coherent you're able to become physically, the more you're reconnecting emotionally and spiritually too. So your perception is going to change. Your emotional capacity is going to be more. Your relationship with stillness will never be the same. If you were someone who was really uncomfortable with stillness and you start doing some of this fascia work, then stillness is not going to feel as physically bad. And therefore, you're going to get into that deeper state of those mindfulness meditations, for example. I think modern humans live so disconnected from this, and a lot of us do live from the neck up. We just live in our heads, and getting into our bodies is very often the key to healing. When we're able to actually slow down enough to feel ourselves through breath and movement and nervous system regulation and body work and time in nature, something deeper is happening. And this is what I want you to take home from this episode today. We can return to relationship with self. Our organism is rhythmic and fluid and dynamic. And in order for electricity to move through and communication pathways to work optimally, our fascia does need to be nourished and healthy. Healing is not about forcing change. It is about restoring the conditions that allow communication and flow and adaptability and safety to return. And this is really only the beginning of the conversation, because next we're going to go deeper into the extracellular matrix in some episodes, and the interstitial fluid and lymphatics and cerebral spinal fluid and mast cell physiology and all of the connective tissue changes during perimenopause and menopause. Because again, a lot of women come in and they say, I'm in pain or I'm having panic attacks. So this is all manifesting in really acute ways that are interrupting daily life. And today I want to leave you with this. Remember, Your symptoms are not signs that your body is broken. Your symptoms are not things that we want to suppress. They're communications. And they're signs that your body has been trying to protect you for a very long time because fascia is protective tissue and it's responding to us all the time. And if we live in chronic fear and hypervigilance and we brace long enough, eventually the connective tissue begins reflecting those states too. But the opposite is also true. When the organism begins experiencing safety consistently, the body reflects that. And I think this is one of the most important things I want you to take home from this episode. And just remember that story follows state. So the story you're telling yourself in your mind and your experience mentally and emotionally follows the state of your nervous system, which follows your fascia. As always, if this episode resonated with you today or you found it helpful in any way, please share it with someone else who might benefit from understanding the connective tissue that not only animates us, but also helps us get into a healing state.